Scene script. Have you ever wondered if abortion can cause infertility? It's a question that's often asked, and the answer may surprise you. The common perception is that abortion can lead to infertility, but the reality is, scientific evidence doesn't support this belief. In fact, a safe and legal abortion, performed by a qualified healthcare professional, isn't linked to long-term fertility issues at all. Abortion is a medical term for ending a pregnancy. This can be done through medication or a surgical procedure. The type of abortion a person may undergo depends on factors like how far along the pregnancy is and the preferred method of termination. Now you might be thinking, but can having an abortion affect my future fertility or cause issues in later pregnancies? Well, the good news is that research suggests abortions do not directly cause infertility. The risks associated with both types of abortions, whether medical or surgical, are relatively low. This means that a person can get pregnant soon after having an abortion, provided they are not using contraception. It's important to note that complications from abortions are rare, particularly when the procedure is carried out in a medical facility under the supervision of a healthcare professional. Serious complications that could potentially impact fertility, like an infection or injury to the reproductive organs, are extremely rare when the abortion is performed in the correct conditions. However, there are a few rare complications that can occur following an abortion, which may affect fertility or future pregnancies. These include infections, Asherman syndrome, which is a condition where scar tissue forms inside the uterus, and preterm birth. But even these complications are rare and can often be prevented or treated with the right medical care. Thus, a person can still get pregnant soon after having an abortion if they do not use contraception. It's crucial to debunk misconceptions about abortion and fertility, and to rely on scientific evidence when making informed decisions about reproductive health. After all, knowledge is power, especially when it comes to our bodies and our health. However, while abortions generally do not cause infertility, there are some rare complications that can occur after an abortion. Let's take a closer look at these. One potential complication is infection. If the uterus or fallopian tubes become infected, this can lead to inflammation and scarring. This scarring may block the passage of eggs or sperm, reducing the chances of future pregnancies. It could also increase the risk of an ectopic pregnancy, where the fertilized egg implants outside the uterus. The good news is, this can be prevented. Taking antibiotics as prescribed and adhering to the aftercare instructions from your doctor can significantly lower the risk of infection. Another possible complication is Asherman syndrome. This is a condition where scar tissue forms inside the uterus. This can interfere with the implantation of an embryo or even lead to miscarriage. Asherman syndrome can occur after a surgical abortion, particularly if the procedure involves scraping the uterine lining, a process known as dilation and curettage. The risk of developing Asherman syndrome increases if a person has multiple abortions or infections. But don't worry, there is a treatment for this condition. Surgery can be performed to remove the scar tissue and restore the uterine cavity. It's important to remember that these complications are rare. Abortions carried out by qualified healthcare professionals in a medical facility with proper supervision are generally safe procedures. The key to preventing complications is to follow the aftercare instructions provided by your doctor. This may include taking prescribed medications, avoiding certain activities, and scheduling follow-up appointments. Therefore, even though these complications are rare, it is important to follow the aftercare instructions from your doctor to prevent them. Remember, your health should always be your top priority. And while we're on the topic, don't forget that using contraception can prevent unwanted pregnancies and the need for an abortion in the first place. So keep yourself informed, stay safe, and take care of your reproductive health. There is also a concern about the association between abortion and preterm birth. Preterm birth is characterized by the birth of a baby before the completion of 37 weeks of pregnancy. It is associated with a variety of health issues for the newborn, which may include difficulties in breathing, bleeding in the brain, or even developmental delays. Now, some studies suggest a slight increase in the risk of preterm birth among women who have had one or more abortions. However, it's important to note that the exact reason for this association isn't entirely clear, It could be attributed to various factors such as infection, inflammation, or cervical damage that might occur during the procedure. But remember, this is just a possibility and not a definitive outcome. So what can be done to reduce the risk of preterm birth? A healthy lifestyle can significantly contribute to minimizing the risk. This involves avoiding harmful substances such as smoking, alcohol, and drugs. Regular prenatal care is also essential. Regular checkups allow healthcare providers to monitor the health of both the mother and the baby and identify any potential complications early on. Treating any infections or medical conditions promptly can also help reduce the risk. If you've had an abortion and are concerned about preterm birth in future pregnancies, discuss this with your healthcare provider. They can provide you with the necessary information, guidance, and support to ensure a healthy pregnancy. In conclusion, while there is a small risk of preterm birth associated with abortion, it's not a definitive outcome and can be managed with proper care and lifestyle modifications. The key is to stay informed, seek regular medical care, and maintain a healthy lifestyle. And remember, if you have any concerns about your reproductive health or fertility, don't hesitate to reach out to a healthcare professional. They are there to provide you with the necessary guidance and support based on the most recent and reliable scientific evidence. So, while there is a small risk of preterm birth associated with abortion, it can be managed with proper care and lifestyle modifications. Despite the fears and misconceptions, the fact remains that abortion, when performed safely and legally, does not cause infertility. We've walked through various aspects of this issue, debunking the myth of abortion leading to infertility. We've also shed light on the rare complications that could occur post-abortion, such as infection, Asherman syndrome, and a slight risk of preterm birth. However, it's crucial to remember that these risks are low when the procedure is carried out under appropriate medical conditions and supervised by a qualified healthcare professional. Any potential complications can be managed effectively with proper care and attention. This is why it's imperative to ensure any medical procedure, including abortion, is performed in a safe and legal environment. Thank you for watching. Remember, knowledge is the key to making informed decisions about your health. Now, we need your help to spread this valuable information. Please subscribe, like, and share this video with your friends and family. Your support can help us reach out to more people, providing them with health information. We also encourage your feedback. Please leave us a comment below with your thoughts or any questions you may have. We value your input and would love to hear from you. Until next time, stay informed and stay healthy.